I'm Linda Wilhelm. I'm president of the Canadian Arthritis Patient Alliance here in Quebec City at the Canadian Rheumatology Association annual meeting. And I'm interviewing Dr. Robert Ferrari about an initiative that the Canadian Medical Association has started called Choosing Wisely.
Hi, I'm Robert Ferrari. I'm an internist and practice internal medicine and rheumatology in Edmonton, Alberta. And I'm a member of the Choosing Wisely Committee for the Canadian Rheumatology Association.
Dr. Ferrari, I know that Choosing Wisely has been around for a couple of years now. The Canadian Rheumatology Association jumped on quite quickly to look at the recommendations of the initiative. Can you tell us a little bit about the Choosing Wisely and what it means and what it does and how it applies to physicians and patients?
Sure. Choosing Wisely began in the United States in 2012 by the American Board of Internal Medicine. And since then, at least 80 societies or 80 groups of specialists in the United States and 30 groups of specialists in Canada have each come up with a list of 5 or more topics or issues that come up with regard to testing or treatment that we want to create, shall we say, some do's and don'ts around. So for the most part, we've created a list of don'ts, such as don't order this testing unless it's in the appropriate circumstances. And with some treatments, we've created a list of don'ts as well. Don't prescribe this treatment unless certain conditions are present. And the aim of Choosing Wisely is just that. It's not about rationing tests or rationing treatments. It's about directing treatments and tests to those who need it, and not directing treatment or tests to those who don't need it. So it's about not being wasteful. It's about being more thoughtful when you order tests. And it's also about, because it involves the Choosing Wisely projects, involve patients, in the Canadian Rheumatology Association has involved patients in the project. It's about helping patients and doctors collaborate or be co-decision makers in whether tests are appropriate or not, so that patients feel that this is not simply rationing or limitation testing, but rather it's very thoughtful testing because it involves them. And so Choosing Wisely therefore brought together different specialties in the Canadian Rheumatology Association. A group of rheumatologists, rheumatology trainees, and patient support groups and patients themselves came together. We came up with a list of some tests and some treatments where there may be some waste, and we asked our membership to really look at that list and come up with the top 5 and support those top 5 and ensure that our membership is doing that, is following those recommendations, with the hope that those recommendations will then filter down to other physicians and become something that patients are more aware of, patients with arthritis and rheumatic conditions.
Well, it's very exciting for us, for CAPA, for our members to be involved with this initiative. And that the Canadian Rheumatology Association was actually one of the first ones to come out of the gate to involve patients in this. Some of the other ones didn't. And we know that there are more rounds to come for other specialties as this moves forward. So we're really excited to see it. And I know that there's a project now about getting it translated into French and really to expand this and make sure that, because as patients, we want our healthcare resources to be used in the best possible way. We recognize that if those who are getting the test unnecessarily may then result in wait times for somebody who really needs to get that test much quicker. So we're really excited to see that. Is there any future plans? You said about surveys to see what the future will hold and how you'll be able to tell if this is actually working and giving us efficient use of the system.
Sure, we are surveying, first of all, our own membership to make sure our own membership continues to be in agreement with these top 5 choices and that they're continuing to practice those things. And then we will conduct surveys in the future to see if that information, that those concepts are being retained by our own membership. We have to really set the standard and we have to maintain it, and then we can perhaps expect that others will do the same. So that's ongoing, and then moving forward, we're going to look at projects that help us both educate patients and physicians about choosing wisely across the societies and about how we can start implementing those in practice, which will involve a lot of groups, including government.
That's really great. And just a little bit off the topic, just about this meeting that we're at this weekend here in Quebec City. Can you tell me a little bit what the most exciting thing that you've seen or heard so far at the meeting?
Well, I think it'd be self-advertising. I said it was my presentation on choosing wisely. But really, if I think about choosing wisely, and we talked about this earlier, this is the first example I can think of having gone to national meetings where there are, well, between the United States and Canada, well over 100 different specialty groups, all talking and meeting about the same thing. Because we're all doing our own choosing wisely. Somewhere there's another conference like this, for neurology or internal medicine or cardiology, and someone's having a discussion on choosing wisely. And so we're all in parallel doing this same project. We're all coming up with our own lists that are appropriate to our specialties, and then we're all in different stages of moving that forward. And I really can't think of another example among the specialties where we're all doing that. And this is something that has happened in the last 2 years, so it's quite exciting, and it's quite unique.
So I assume patients, if they want to learn more about choosing wisely, they can go to the Canadian Rheumatologists Association website.
So there's information there that links you to Choosing Wisely Canada, which will link you to what 30 other medical groups are doing. And there's also the list there about what the Canadian Rheumatology Association chose as their top 5 things to move forward. And there are links there to Choosing Wisely also in the United States. And so just from that website alone, you can get to all those places.
Well, thank you. And thank you very much for coming and talking to us today. This is very important for patients to understand, what tests are important for them to have and what ones might not be so important. And I know as a patient who's had to undergo many, many tests, I don't want to be having something that really isn't absolutely necessary to my health care and to my outcome. So thank you very much for coming by our booth.
Appreciate it.